Hey guys, Lawrence with Laws of Physio, with back again with the back pain series, and today we're gonna finally sum it all up and get you better. Okay, so we're gonna fix your back pain today. Hopefully, I'm gonna teach how to fix it. All right, so well-known secret: the best way to get better is to have a multidisciplinary approach with exercise as the focus. So that means you get help from different specialties, your doctors, your physios, your GPs. That's the same thing as a doctor. Um, OTs if you need it, psychologists if you need it, your mate, your personal trainers, the gym. Just get a team around you that have a similar focus, and that focus is to get you stronger, to get you better. Okay, so the reason exercise is the focus is because it is the most evidence-based and most backed therapy out of everything. So you can go through all the therapies in the world, but if exercise isn't the focus, then you're not going to get better. Okay, so motion is lotion. You got to move. Moving is important. So we do it to keep your muscles strong, keep your joints loose, strengthen your ligaments, make sure everything's well lubricated, make sure your nerves aren't getting tight and they're not painful, increase your pain tolerance, increase your bone density. It's just good for you, it increases your heart, the strength of your heart. You got to move. If you're not moving, then what are you doing to yourself, And a lot of people come in and they complain, oh, I used to be able to do this, but I haven't done it for 5 years and it hurts when I do it again. And the analogy I use is that's pretty much asking a baby to go deadlift 100 kilos. It doesn't work. You gotta slowly work up the baby and then it can deadlift 100 kilos. Medication. So medication isn't the fix. It is something to assist you on your rehab. Okay, so if you're in agonizing pain, a bit of NSAIDs, so non-steroidal anti-inflammatory drugs, a bit of painkillers, you can take the edge off, and that is to facilitate you doing your exercises and actually moving and getting back into some kind of functional movement. Okay, the main thing is just don't get reliant on it. And best way to do that is just listen to your GP, follow your prescription, and take it in conjunction to other therapies. Manual therapy, so this is stuff that I can do. So passive mobilization, which is pretty much me stretching the joint for you. Massage feels awesome, everyone does it. A lot of people don't like it, but if you hit yourself, you normally grab yourself straight away, and that's a form of massage. So there's nothing against massage, as long as it's combined with other things. Active assisted movement, so sometimes you need a helping hand. If you can't move your arm, I'll help you, and that's my job. And a bit of needling and acupuncture. So I personally find needling works really well. I personally prefer that over massage. Something about it just gets me going. So as long as you combine it all with exercise, then it's fine. Okay. And the last one is cognitive behavioral therapy. So mindset is everything. If you believe you're going to get better, you'll get better, no matter what. If you think you're not going to get better, you won't get better. So cognitive behavioral therapy is pretty much the way we talk to you and the way we discuss and plan your rehab, just to put you in a better mindset to get yourself better and actually want to improve. Okay. Last of all, multidisciplinary team. So all of this, if you can work as a team, teamwork makes the dream work. So if you want to get better and you need a bit of help, health professionals, you got your doctors, you got your family, you got your friends, you got your bartender if you need, you got a dog, so Bear Corgi, follow Bear X Corgi for cute videos and for exercise tips. But in the end, we're all human, we all go through pain, and the only way to get better is together. So if you liked the video, give me a like. Otherwise, I'll catch you guys soon, and I'll probably go through some exercises on the next one. So leave any comments of any questions, and I'll get back to you guys. Cheers.